All right. Good morning, good afternoon, depending on where you're logging in from. My name is Kate Bruner. I am the Youth and Family Services Consultant at the Colorado State Library, and my pronouns are she, her. This is Talking Teen Services webinar series today. We are having a panel discussion, which I'm really excited about. Talking Teen Services is a series of webinars and panel discussions like this that we host at the Colorado State Library on a variety of topics related to serving teens in our communities. And this series and all of our Colorado State Library Youth Services offerings are created by the librarians in the library development team at the Colorado State Library. And our staff positions and operating expenses are paid for by grant funding from the Institute of Museum and Library Services, which allows us to provide these at no cost to you all. At the end of the session, we will ask you to fill out a feedback survey. So if you would like to hang on to this link now, I will share it again at the end of the session. But if you'd like to just hang on to that in a tab, like we would really love to hear your feedback towards the end. If you're watching the recording of this session, you are also welcome to fill out a survey and let us know what you think afterwards. So, okay, thank you for your patience as we kind of run through all that opening. And today I'm really excited to have some amazing panelists with us, and I'm going to ask them to introduce themselves before we get started talking about how to see our unseen caregiving youth. And so I'm going to start with Nadine. I'm going to start with you, if you would mind introducing yourself.
Absolutely. Thank you, Kate. And hello, everyone. It's so amazing to be here today. And we are so glad that you thought enough of this topic to show up and to commit to learning all that you can learn about this hidden population of caregiving youth. I am Nadine Roberts Cornish. I am founder of the Caregivers Guardian, a support services for family caregivers. But it's only been recently in the last 3 to 4 years that I've gotten entrenched in this issue around caregiving youth. And I founded Colorado Alliance for Caregiving Youth, CASey, as a result of the void in the state of Colorado of resources and programs that were addressing this issue. And so I'm really excited to be here. I'm especially excited. I'll be passing the baton to Fortuna, a caregiving youth that we worked with over the last year. And she is here as a voice representing caregiving youth in the state of Colorado. So, Fortuna.
Hello, I'm Fortuna Abdurrahman, and I'm here to be a voice for the caregiving youth. Nice to meet you, Mom. Oh, and I'm passing it to Betsy.
Hi, thank you, Fortuna. Hi, everyone. My name is Betsy Olson. You'll see my official name is Elizabeth Olson. I'm a geographer and I'm a professor at the University of North Carolina in Chapel Hill. I've been working with this population first in my previous position at the University of Edinburgh, and then after I moved back to the United States 13 years ago. Became pretty much dedicated to trying to understand, build evidence, and support caregiving youth and their families in the United States. Um, and I'd like to pass to Sarah, please.
Hey everyone, my name is Sarah Nolan, and I work with the Resource Exchange in Colorado Springs. We run 5 programs for respite for families that have special needs children. But a program that is the most near and dear to me out of my 5 is called Our Time, which is a program specifically for youth that are caregivers. So they are special needs siblings that we get together to have a safe space for them. I created it because I am actually a sibling myself. And so I grew up with a brother that is 2 years younger than me with cerebral palsy and oldest of 4 children. So I have played that role and am super excited now as a mother to be able to support the youth that do this that I did too. So, and I'm going to go ahead and pass it over to Liesel.
Hello, I'm Liesel Reed, and I'm the Whole Child Initiatives Coordinator for Adams 12 Five-Star Schools, which is located in the North Metro area of Denver. I have the privilege of leading the team that supports students who are experiencing housing instability and educational instability. We use the term highly mobile youth, and that encompasses youth who are experiencing homelessness under the McKinney-Vento Act, including unaccompanied youth. Youth who are involved in the child welfare system, youth who have been identified as migrant by the state, and then our many Afghan evacuees and refugees from Central and South America, as well as Ukraine. And so I'm here to really present that educational lens. I believe that's all of the panelists.
Yep, I think that's everybody. And I also have my colleague Susie Tanini is here with us today. She's our school library leadership consultant as well. That's giving us a wave. She's going to be who is going to keep an eye on the chat and catch your questions for us for the end of the session. So, okay, so I'm going to jump into our very first question, which I'm going to ask Nadine to start us off again with that one. But who are youth caregivers and why do they often go unseen?
Okay, thank you for the question. And our youth caregivers are the kids you least expect. And they're the kids you most expect. They're kids who fly under the radar. They're not trying to be seen. They're not trying to bring attention to themselves, but they are absolutely shouldering this very adult responsibility all too often. For my first experience with actually identifying a caregiving youth, it was a 12-year-old who actually participated in a webinar just like this for adults. He was introduced by his grandmother, and the question that he asked after he had heard everything that I had to say to the adult caregivers was, "It's cool what you do, but what do you do for kids?" And that simple question, it baffled me because, well, I support your parents and your grandparents, so they have access to the resources, and so that they are equipped with everything that they need, so that they're able to take care of their loved one, and of course, be available to take care of you. And it was like, no, that is not what I meant. What do you do for kids who are caregiving? And that was the first time in my almost, at that point, it was almost 16 years of professional experience where the question of caregiving youth and the reality of caregiving youth actually slapped me in the face. And it was the catalyst for my shifting to help to create a program and an organization that's specifically dedicated to educating and raising awareness. And so, with that, shall I ask Fortuna to respond to that question or
Yeah,
Kate?
no, I think
Yeah.
that was
Okay.
exactly who I wanted to take the conversation to,
Okay.
and ask you to share with us a little bit about maybe your story, who you are as as one person who is a caregiving youth, and then maybe what you think contributes to folks not necessarily always seeing and understanding and valuing the work that caregivers are doing in their families.
Yeah, I said, I've been a caregiver since I was about like 7 of my oldest sister, and then recently my mom had a baby, and we also caregive for her as well. My oldest sister, she's 20 now, and I'm 18, so we're kind of close in age. So yeah, I started caregiving very young. Um, and most caregivers like worldwide, they're often expected to caregive, and it's seen as normal rather than labor that like deserves recognition.
Mhm.
Well, thank you for sharing. Yeah, anything else? Okay, just making sure I didn't step on you. Like, okay. And then thank you for that's two perspectives there we have on and our most valuable is our caregiver who is here with us today. And then I also want to ask Betsy, who has done a lot of research with caregiving youth and partnering with them as well in her research to share a little bit about her experiences of like who these young people are and what contributes to them not being necessarily seen in
Sure.
their
Thank
communities.
you. Thank you for organizing this webinar. And I just want to echo Nadine's gratitude for everyone who's here today, because this is really the first step in having the U.S. begin to acknowledge and recognize caregiving youth as caregivers who deserve support. I also want to take a moment to thank all of you who are caregivers and your families. So, yeah, we define caregiving youth as young people under the age of 18 who have care responsibilities for family members due to health conditions. So that might include age-related decline, it might include disability, chronic illness, and then that also does include mental health concerns. So things such as substance misuse disorder are included in this category. I began working with the population when I was in the United Kingdom. And one thing that I'll tell you right away is that the United States um, is improving its understanding and awareness and support for caregiving youth, but we've generally been considered to be pretty far behind other countries. So I came to learn about this population when I was doing research with young people growing up in areas of economic deprivation. This was yeah, nearly 2 decades ago. And at that time, I was introduced to groups of young people who were recognized as caregivers. They're called young carers in the UK and throughout Europe. And in general, if you're looking for the population, you might find that that term young carers is used interchangeably with caregiving youth. And in the United States, we've stuck with caregiving youth for various reasons. But I found the population to work with because they were well organized. They had supports at the county level, the equivalent to the county level. They might be recognized by a teacher who learned that they were supporting a family member, or perhaps when they took a family member in for a medical appointment. They might have been translating for them. They might have been administering medicine or providing physical support of all different kinds. So we know that in the UK as one of the leaders in recognizing young carers, there has been a progression of policy and research decisions that have helped support this population. In the United States, we've really only begun to legally acknowledge the population. They've tended to be left out of research. So if you look at most research on family caregiving, the age range stops at about 20. Sometimes it goes down to 18. But some of our really, powerful compendiums of what we know about caregiving in the United States completely exclude this population. And as Fartuna pointed out, she's been a caregiver for a long time. So what we've been doing, and I noticed my colleague Emma Armstrong Carter, sorry, I'm going to call you out here. We've been working now for about 13 years to build up knowledge and evidence of, how many caregiving youth are there in the United States? What kinds of supports do they need? What are their educational, mental health experiences? And in 2023, we were really fortunate to have some great partners in the state of Colorado who allowed us to include a question on a survey that goes to all of the students in the state. And through that partnership, which was with Nadine and the American Association of Caregiving Youth and several agencies in the state of Colorado, we were able to understand the population there as well. So we know in Colorado, we're going to have nearly 14% of the young people in your schools are providing care for a family member, 1 day a week. We know that then that number drops for high levels of responsibility. But, the percentages that we saw in the state of Colorado echo what we expect to see in the United States. About 5.4 million at minimum young people in the United States are providing care for family members. Some of those young people are providing care for a parent who might be a single parent. Some of those young people are providing care for siblings or for aging adults, grandparents who move into their home, or grandparents who were and still are providing care for them. So we talk about care as being reciprocal, but our definition is really an attempt to try to acknowledge that young people are indeed participating in caregiving as family caregivers, and yet they're generally left out of policy, research, and practice. So the folks that you see on this panel, I think, are very dedicated to shifting that trend and trying to find ways that we can all support caregiving youth, regardless of where we are, regardless of whether we're writing policy.
Thank you all for that. Sarah or Liesl, did you guys have anything you wanted to add on this particular question? No? Okay. Okay. Yes, Nadine, please.
I just would like to add that the awareness is so incredibly important, and today is a huge first step in being aware of the issue. Betsy and her team were really instrumental in working here in the state of Colorado with helping ensure that we got that question added to the survey. And we're actually going to have data now, comparative data, in the spring of this year, so that we've got 2 years to compare and show the trend that definitely is happening. And with that awareness, it really then places the responsibility on each of us to ask ourselves, what is it that we're willing to do? Are we willing to approach a child and have a conversation with them about what's happening at home, etc.? So that's it. Thank you.
Yeah, thank you for that, Nadine. Yeah, I'm really excited that we're building a data set. And I also don't want us to forget, as I think Nadine, you've said plenty of times, that those numbers represent kids. So we can look at those percentages and those numbers, and we need to remember that those are young people behind those numbers for sure. So I'm glad we're building that data set. And I also want us to build relationships with the young people behind that data too. So and I think libraries are pretty good at that. So I'm glad folks are here and we're having this conversation. So okay, so next I just wanted to ask maybe some of our panelists to share whether or not you think there are misconceptions about youth caregivers that maybe library staff should be aware of, and how folks, adults working in with youth pretty much in any capacity, including the library, can avoid making assumptions about young people's situations. So I don't know, Fortuna, would you be willing to start us off? Do you have any thoughts about that?
Yeah. Many youth handle serious responsibilities like giving medication, translating for parents. As of for me, I'm a child of refugee parents. Also caring for other siblings, household management, and emotional support. And assumptions like having late assignments and being exhausted and being constantly irritated may stem from caregiving duties and not lack of motivation or just not wanting to do work. And we can avoid assumptions by asking open-ended questions as of is there anything going on outside of school that's affecting your time or energy? And librarians can also offer flexible and various spaces for homework and quiet time. And this is for the school, they can train staff on recognizing invisible responsibilities. And I feel like this is for everybody, not just the librarians, but people should be asking themselves, what responsibilities might this person be carrying that we can't see, and just having an open mindset when it comes to that.
Yeah, so important. Thank you so much. I just find that very important, an important reminder for me, for myself, right? Something that I need to hang on to and remember as well. So, Sarah, oh, go ahead.
Sorry, Katie. Kate, I think one of the misconceptions too is that we are strong, and we are strong. Fortuna is so strong. You can see it in just the way she talks. However, there are times that we need to break, that we need that opportunity to be vulnerable and not be the strong one, because we are strong so much for our family. And so there, we need that space that we can, share. One of the young ladies that absolutely a story that will remain with me forever is a young lady that was probably about 12 years old. And she was at one of our respite events. We didn't have the sibling at that point, but we invited them. And she was crying. And I said, "Hey, what's going on?" And she said, I got to be on my test and it's going to bring my grade down. And I don't know what to do. And I'm like, you're killing it. Like, you're doing great. And she shared with me that her sibling has a condition where she basically will be about 6 months for her entire life. And so she can't get the A's and the B's. And so there's just these two sisters. And so this one sister felt like she had to get all the A's because she had to have the brunt. And that's not even what she would do as a caregiver, as far as, helping to feed her and helping her to get her shoes on. It's that emotional that she takes on. Her mother's a teacher. And so she wanted to make sure that she had those straight A's because she knew that her mother couldn't get that from her sister. And so just those stressors that a lot of times are underlying stressors that you may not see, you may not even think about, that come along. And they always want to be strong, right? They've got to be strong because they've got to put on this face. And so if we can allow them the space to not be strong and to have those moments, because in this situation, this particular child could not tell her parents this. And of course, I couldn't because I was in a trusted state, safe space. But I was then able to kind of check in with her at events and reassure her that you're doing the best you can. Your parents are very proud of you. They're proud of your sister. You are strong. You are capable. And just be that, because we can all have that face, but sometimes we just need to be a little sad sometimes.
So, Kate, I'd like to add, and Sarah,
Please.
thank you
Yeah.
for that perspective. Even though the caregiving youth oftentimes are invisible, it doesn't necessarily mean that they want to be invisible. They use the invisible cloak as as sort of as a safety mechanism, and that oftentimes caregiving youth welcome the opportunity to talk. They welcome the opportunity for a caring adult to show up caring, not judgmental, but caring. And I think that if we are all intentional around recognizing that when we choose to have a conversation, that we're doing so with an open mind and open heart and leaving the judgment outside, right? And so, thank you.
Thank you, Nadine. Would anyone else from the panel like to add anything?
Yeah, I can jump in and hopefully I'm not getting ahead,
Please.
but I think that libraries are inherently safe spaces and that they allow for these conversations to begin and not begin with what's going on at home, but begin with a smile, a quiet, calm space, and even just a conversation about what that youth's interests are. And so opening the door for that, because very few youth are going to come right out and say, this is what's going on at home, because they are being that strong person that Sarah referenced. So I think, in education, we talk about greeting students at the threshold of the classroom and how far that goes, knowing people's names and how to pronounce them correctly. And so I think the conversations that Nadine and Sarah and Fartuna are talking about is a result of very genuine questions about their interests.
Kate, I would just add briefly I've really enjoyed hearing from everyone else. Thank you for those insights. On this point about misconceptions, I'm curious how many people on the webinar today, if you can just indicate by raising your hand, how many of you believe that you have met through the course of your work a caregiving youth? Just go ahead and put up your digital hand. Yeah, so we're seeing quite a lot. Um, a lot. We're going into screen two for me. I think one of the really phenomenal things about the libraries getting involved here is because I do think already there is some really interesting potential contact that happens. It's a little bit different from what young people might experience elsewhere. Um, and obviously, this is very relevant to everyone on this call. I wanted to just add a few things, that we've learned from the research. Oftentimes, young people are caregiving for more than one individual. So that they might be caregiving what you know to be explicitly a grandparent and or a parent. And then you might learn as you get to know the young person that there's additional caregiving duties. So I'll give one example of a family that we worked with in Florida. The young person, we were speaking with her because she was caregiving for a father with early onset dementia. But through the course of our work with her, we learned that her sibling also was on the autistic spectrum with pretty serious care needs. So she and her sister were caregiving for both her father and her brother, but it wasn't registered as such because this was a different kind of need and they hadn't necessarily brought it forward for support. The other thing is that a lot of our caregiving youth might end up working. This has to do with some of the dynamics that occur in families that have extreme medical needs in the United States. So oftentimes they will be um, families or households that do not have a lot of financial resources, especially for higher levels of responsibility. If you don't have money to bring in private respite or relief for your young people, you might have to rely more on them for care. That's not to say that only low-income households have caregiving youth in them, because there's a lot of different dynamics that contribute to the decision to be caregiving youth. So in my family, it was taken for granted that my cousin would help to care for my grandmother when she was aging, and that has to do with our cultural foundations. The final thing that I would say is when young people are caregiving, they, like all adults, go through a caregiving journey and their caregiving changes over time. So they might be starting as a young person, providing direct care, perhaps keeping people company, or cooking meals. And then they might progress as they get bigger to other kinds of responsibilities, including medication, which, Fortuna mentioned. And we know that really high percentage of caregiving youth are responsible for administering medication. And then as they get older and can enter the workforce at, whatever age is appropriate for their state and their location, they might be required to go and work for their families, and they still will be providing care. So much like adults who might be having to provide care from a distance, many of these young people are providing care while they're in school, while they're working. They are on the phone, they're trying to figure out, is someone taking their medication? Did the respite nurse show up? Do they remember a plan for pickup at the end of the school day, and so on? So that's just a few things that we've learned through the research. There's many more, but when I think about misconceptions, it's to say that caregiving youth might be doing a lot of different kinds of things in order to provide their caregiving support for their families and kin, because the other misconception that I would say is that caregiving youth are not only caregiving for what might be a traditional conception of the family, but we know from kinship care that family can be defined in many different ways. And so young people are also participating in that kind of care.
And every family is unique, like something to keep in mind too, right? Yeah. So Betsy, I'm actually going to come back and start with you on this next one. And you've kind of already talked a little bit about this, but if there's anything to expand on that, but what are the most common challenges or needs you see among these young caregivers that you've worked with? And what do you think keeps them from participating in like community-based programs?
Sure. So when I'm answering this question, I'm referring to both larger sets of research that I've done with Dr. Emma Armstrong Carter at Tufts University. And these are state level surveys, but also my expertise is actually in qualitative research. I like to make movies with kids and do all kinds of crazy geographic engagements. So we give them GPS units and send them out for the day to try to understand what an everyday experience of caregiving is for young people. So I'm kind of combining a lot of different data when I'm answering this question. The first thing that I would say, I'd like to actually start with the benefits. And Sarah alluded to this while also emphasizing that we need to be cautious when we're talking about the benefits of being a caregiver. But we do see with these young people that lots of times they love the person that they're caregiving for. And if they're well supported and they have a good relationship, that can be a relationship that really benefits them. We see evidence of empathy, for example. They also have a lot of maturity and self-reliance for the very reasons that we can anticipate from this population that we're describing. They can be very motivated to make, a good life for themselves and their families. I'm guessing that Fortuna joining us even from school is really good example of that. Um, and then they also truly understand the value of care. And one of the interesting things that we've noticed from the qualitative research is when you speak with these young people, they speak in a really sophisticated manner about an ethic of care. And, how does that include your family or your community? And so we're really struck by that. But there are, as you would anticipate, many challenges, especially in the United States. And I'm comparing this now mostly when I think about countries in Europe where I also work. But, even in Colorado, we know that there's concerns about mental health and well-being and ability to participate fully in education. And this shows up in the data that we collected from Colorado. So caregiving youth can often suffer from mental health problems and challenges, and also lower grades, other evidence of difficulties in accessing the full range of educational benefits that we would hope for. They also have a lot of the same tolls that, again, I'm going to emphasize, like kids might be going to school as kind of their main work thing, but any of us who have been caregivers as adults know the kinds of emotional tolls, the exhaustion. If you're being woken up at night and part of your caregiving support for your family is helping someone settle and get back to sleep, that can also be very disruptive for sleep. We know that there's financial constraints that hit these families oftentimes in a different way than other families. And then on this point, it's really important to have good and open conversations, but we also know that there's a lot of concern within our communities about exposing these aspects of your family because they're going to be misunderstood, or at least that's the fear. And to be honest, in a lot of places, they will be misunderstood. So, some of the reactions that we've had to the work that we've done, and now I'm thinking about we being with Dr. Connie Siskowski, the founder of the American Association of Caregiving Youth. We wrote an op-ed a long time ago for The Hill to try to get the Raise Family Caregiving Act to recognize caregiving youth, which it did. But some of the responses, the editorial responses, were pretty shocking. I think I'm going to assume that for the people in the room. They were saying, why are these kids caregiving? Where is social services when you need them? So I think there is a real concern about what this even means, how people interpret the data. And, in fairness, when you're working in that industry or you're trying to look out for the well-being of a young person, you don't understand what caregiving means for a young person. There is potentially a concern. And some of the young people do end up in really difficult situations, especially if you're talking about substance misuse disorder and having to care for an adult who's suffering from that. There's also evidence of bullying, both being bullied, and this can be pretty extreme and severe. It can happen both at the school and outside of the school, or in transit to the school, and sometimes becoming bullies themselves because of these pressures to try to defend yourself or your family. We were surprised with the qualitative research how much attacking is done of individuals who require care, family members such as siblings or parents and grandparents. Um, there are really practical limits to participation then. As you can imagine, when you scroll out all the information that you're learning today. So I've broken this into a couple of categories. One is kind of this practical infrastructure thing. Like kids just don't have time. If you are getting up in the morning and you're helping your mom get out of bed, you're helping her toilet, you're then helping her get breakfast, and you're waiting for your respite individual to arrive. I'm telling you the story of a 12-year-old boy with a single mom. Then he waits for the nurse to arrive and he's getting on the bus. He's going to come straight home because there's actually a period of couple of hours that the respite care will not be with his mom. So he's a little concerned and he's going to rush home and he can't really go do other things that kids his age are doing. So, a limitation on respite. Finances are always a problem. So there's kind of those practical things. There's also a category that I would call belonging. Um, so feeling like you belong in a place, the ease of participation. The lowering of barriers includes, I would argue, an understanding of what it is to be a caregiver. So oftentimes our young people will say things like, I feel pretty alone, like no one understands me. And Dr. Connie Ziskowski is always reminding people that this is really important, that oftentimes as adults, as caregivers, we feel really alone. So imagine if you're a kid and adults never even ask you the question if you're helping out that way. And so knowledge is one of those barriers, feeling like you walk into a place and someone is going to understand you. And so I think that is related to relevance. If a kid has a lot of responsibilities, what kinds of offerings are going to be relevant for them? So if they can only choose a few things that they can do in a week, how do you make sure that your offerings might be relevant to them? Is it worth their time to be involved? Is it worth the scarce resources of their family to be able to go and be involved in something? And then the final limit is trust. So again, families often have low trust in our public services. They're concerned that someone is going to misunderstand or misrepresent their situation and report them. And then their family is going to be in a difficult situation. For needs, we did ask a question in the qualitative research where we said, hey, if we gave you a magic wand, what would you wish for? So you can wave it and, you can't actually change the caregiving situation, but you might be able to get resources or something. What would you change? Um, some of the kids were like, well, universal health care, that would be nice. But others said, things like robots who can help administer medication. Um, I think the main thing that came through, however, and the biggest commonality was the idea of recognition and respect. And Nadine used that word earlier as well. This idea that you might go into a place and someone would say, like, I see you, I get you, I understand what you're doing, and thank you. And I can't solve all of your problems for you, but as Sarah said, here's a space. Here's, a small place where you can take care of yourself and where I understand, and you don't even have to tell me anything, but you be you and you do what you need to do now. So those were really common in terms of the kinds of needs that we would hear expressed. And of course, teachers being more sympathetic, having more time for homework. This will be an endless thing. But just to kind of summarize those couple of points.
Thank you, Betsy, for kind of grounding us in that research and the work that you and others have done to help kind of capture young people's stories. So, Nadine, I was going to ask you if you had anything else you would like to add to this.
So Betsy is the E.F. Hutton in my life. When she speaks, you just have to listen. She has such an incredible breadth of knowledge and insight that she brings to the table for every audience that she presents to. So I'm so glad that she's here. And the only thing that I want to add is that the thing that can keep caregiving youth from participating in community programs is when community programs don't exist for them. When we launched Casey, we knew that this was a huge problem and that there would be no one organization in the state that could solve it. There would be no amount of money given to any one organization that could fix this problem. It is so important that we begin to think about how can we incorporate programs into existing programs, specifically addressing the needs of caregiving youth. And when it comes to schools, one of the things that I'm really excited about that AACY has done, and that's the American Association for Caregiving Youth, Connie Staskowski's brainchild. What they have done is they have created a certification program, an acknowledgement of caregiving youth, where caregiving youth actually get credit for the work that they do as a caregiver. So accommodations are made for these kids in the schools. They're given extra credit, recognition, and acknowledgement for what it is that they're already doing. And so we are all going to have to get creative, and especially in light of our unpredictable funding situation for all of us and all of the entities that we're involved in, being creative and trying to figure out and work out ways that we're able to incorporate supporting these kids in programs that already exist, I believe is going to be imperative. So thank you.
Thank you. And thank you for highlighting the word creative because we are actually a week from today going to facilitate, Susie and I are going to facilitate an interactive discussion for library professionals, and we'll send more information out about that with the recording of this session, and also invite your friends, because what we're going to do is do that creative brain work together, really tap into all the amazing wisdom and idea generation that is out there in the library field, and see if we can apply what we're learning today to think more deeply and see what libraries, where the place for our libraries is in this picture. So okay, any of our other panelists want to speak to what might prevent folks from participating in community programs, or any other misconceptions or any other needs or strengths you all would like to highlight?
I'm just going to add this really quickly, that whatever it is that you develop or create, it is imperative that you have the voices of caregiving youth involved in that process so that you're not creating for them, but you're creating with them. Okay.
Thank you for highlighting that, Nadine. Okay, so our next question, I'm actually gonna start with Liesel. And I just wanted to ask, what are some of the important things to think about when you're creating safe and welcoming spaces for young people, both the young people that you have a lot of experience working with, and when we think about that caregiving lens as well?
Yeah, I mean, I feel like all the other panelists are really nailing this. But I would just say that schools are often the most consistent touch point for caregiving youth, and that the need for a deep relationship between the community organizations like libraries and the school district is very important. I think sometimes people think, well, I know this caregiving youth, they have talked to me about their experience, and now I feel like I have to do something, when there are many people and resources who this is what they do on a daily basis. So, for example, my team. They're trained to work with not only the youth, but their caregivers and their families and their teachers to be advocates for, the fact that it's unfortunate, but it's true that schools are uniform. Schools are not often inclined to have modified schedules for youth because we it's an across the board sort of expectation too often. And so I think I might be jumping ahead, but I think a couple of things for the community libraries. I think it's really important to make sure that you have information available in youth-friendly language and visuals. And so, for example, we can give out brochures about educational stability rights all day long. But what we did was we created very large laminated posters with youth-friendly language and graphics and a QR code, and said, if you or anyone you know is in one of these situations, and you would like support, please reach out. It's confidential. And so it was stuff like that all of a sudden we noticed that the youth were really stepping into the light, right? They were becoming less invisible. And I think it's also important for community librarians to know who the points of contact in their local school district or school districts are. And so that's very often a McKinney-Vento liaison, and every state or every district is required to have one. And those lists are on every state education website. For school librarians, I would say get involved. I mean, school librarians are an integral part of any school community. They often see every student in the building. They have the opportunity to notice changes in behavior, changes in a student's patterns, and then they have the opportunity to help educate their colleagues. And I think the biggest thing is that creativity, and I would actually love to attend next week because we have done things in Adams 12, like we have a mentorship framework. Going back to what Nadine was saying, if students enter the mentorship, it's an independent study and they earn credit. And so it's an acknowledgement. While they are getting the benefit of a mentor, it still recognizes and acknowledges the effort that they are putting in to that mentorship. And so other things like going back to that assumption, I know it's very popular now for schools to ban cell phones and electronic devices, but for a youth caregiver, that could be very, very scary. And so if you're going to have that policy, fine. But how do you then help those youth caregivers feel confident that if there is something that they need to reach out, or that it needs their family needs to reach them, that will be possible? And so just thinking about those things and being really thinking about the whole child.
Yeah, thank you for that. Yeah, that's stuff I had not thought about the cell phone policy trend and how that would impact. So thank you for highlighting that. I really appreciate that. Okay, I was going to say, Sarah, if you have anything you want to add, and then Fortuna, if you would like to add, like what makes a good space or what made a good space for you when you were younger as a caregiver, I would love to invite you to share that too. So I'm going to come to Sarah first, and then if you want to engage that question, like I'll come to you next.
I'm going to use the term safe, again, a safe space for them. And a lot of times that can be a very sticky place to be. But allowing them that opportunity to meet other caregiver youths is so, so important. And you're going to listen to some really hard conversations when you finally are able to get them in the situation. You're going to hear things like, hey, dude, like, hey, what's going on? You got, a little bit of a black eye here. Oh yeah, my brother, got really upset yesterday. He didn't want to, transition. He didn't want to, leave the house. And so he threw his shoe at me and I forgot to deck too quick. And so I've got this, but oh, I'm totally fine. And what is, it's hard to listen to, but what's amazing is when you might then hear the other person go back to him, yeah, I've been there, man. You get real quick at ducking, don't you? And it's one of those things that it's really hard to hear, but they need that space. They need to be able to talk to other people and know that they are not alone. And so as adults, we can create this space, but if they don't have the other youth to talk to and to feel like they're not alone, um, it's still great, but that's really fostering those relationships would be great. Giving them mirrors. I see that on the chat. Yes. Knowing that I'm not the only one that's going through this. And so, whether that's creating a safe space and putting out snacks, because a lot of these kids, as they've talked about throughout this listening, they're struggling to financially. And so maybe they forego snacks because their special needs, sibling needs them. So just creating that level of openness and being okay with it, because it's not going to be comfortable. It's going to put you outside of your zone, for sure. But they need that. They need to hear it from others. They need to know that they're not the only one in this situation.
Thank you, Sarah. So I'd just like to open the question up to anyone else who would like to share, not just Fortuna, but anyone else who would like to add on, any of our other panelists who would like to add on to this question in particular about spaces and what makes for a space that is a positive experience for caregiving youth.
As well as like just things like after school programs, or as well as like just community centers, and libraries is a good one, but just things like that, like places where there's resources, or like there's also other peers, um, and access to those resources, such as like transportation, food, counseling, mental health support, academic accommodations, things like that would be great.
Thank you for sharing that. Any other thoughts on this particular question anyone would like to share? Okay. Okay, so the next question I have for the panel, and Nadine, I'd love to start with you, is what types of resources or programs or services have you found most effective in supporting young caregivers? And do you have any thoughts about how those could potentially be adapted to a library setting as people get to know the caregiving youth in their communities?
Absolutely. I was fortunate to attend the Caregiving Youth Conference in Boca Raton, Florida in November, and I got a chance to do site visits to several of the locations that have been implementing, the middle schools and high schools that have implemented AACY's Caregiving Youth Institute program. And this program was just amazing to see. It was simple, but it was so intentionally, it's so intentionally developed to meet the needs of caregiving youth. And some of the things that Fortuna mentioned in terms of resources, mental health resources, tutoring, these are all components of AACY's program. And they implement it on the middle school level, and then they follow the student from middle school to high school. And so it was the first time actually seeing the program in action, and I felt then, wow, this is doable. This is something that we can do in Colorado. And I believe that there are absolute aspects of the program that the librarians can easily implement. Everything from providing that safe space to affording a space so that if counseling and mental health support services are needed, it can be provided in that space. The In AACY's model, the social workers and the mental health counselors are all part of AACY's program itself. But here in Colorado, I think we can easily create a collaboration of partnerships where we are bringing to the table the aspects and the resources that are needed to develop the type of comprehensive program that I believe we need to have here in Colorado.
Thank you, Nadine. Those are very inspiring words. Makes me want to like go out and see what we can do. So I know I appreciate that. And it's so great to hear that there's a model, that ideas can be pulled from and a model that it sounds to me like has been co-designed with
Yes.
Caregiving Youth. Yeah,
Yes.
fantastic. So yeah, Betsy, I was going to ask you any other examples you would like to direct our attention towards.
Yes. So there's, again, referring to work overseas, there's other countries where they would be considered to be pretty far ahead of us. Um, but that's largely because they have federal policies. Part of the challenge that we face in the United States is that we have states, and our education is divested to the states. And so a lot of the work um, I have work with a colleague, Leah Edmonds, who's a professor at Indiana Bloomington now. We refer to this as a kind of patchwork of policies. So in the United States, we're often talking about, trying to kind of piecemeal put this together. So when I think about it, because I'm a geographer, I think about scales of possibilities. So on the one hand, in terms of what kinds of solutions, what can you do? You can advocate for something like a Bill of Rights for caregiving youth in the state of Colorado. In the United Kingdom, young carers are recognized as caregivers and they are recognized as being afforded certain rights that might adhere to caregivers. Um, so that feels like big and a flight of fancy, but we also know that the first GAO study that was, I'm going to pop it into the chat here, uh, was conducted and completed about a year ago on caregiving youth in the United States begins to open the door for thinking, again, I'll use that word creatively, about where we might be able to insist that caregiving youth also have access to resources. So this is, really a federal mandate. It has absolutely no teeth, but it's there for anyone who might want to make a claim on resources that exist for adult caregivers. Basically, the GAO conclusion was that, well, this should also apply for young people. So those are kind of the big things, but the very small things, what I often talk about is the low-hanging fruit, because developing policies, developing programs, especially at a time like this, can be really challenging. We're worried about, is anyone going to have access to childcare anymore if you don't make enough money to pay what we have? So, we're pretty realistic about what exists, what is that low-hanging fruit. So I want to talk through that a little bit. I think obviously collaborations and partnerships, and I want to emphasize that all of the stuff that we've gotten moved in the United States has often been through collaborations and partnerships like we've had with Nadine to have that kind of like I talk about the horse beside the cart. We want the data. We want really well evidence-based stuff. We want to make sure that we are getting stuff, working closely with kids, learning from people like Fortuna who have the experience, while also, being really educated about what is the population that we're looking at. Are there places where we should really emphasize our work? So collaborating with researchers, I'm going to put that really high up. That can be me. I'm happy to work with anyone else who, if you have close researchers in your state, like basically make good use of us. That's why we're here, at least those of us, well, all of us really. And Emma, I'm afraid I just volunteered us for anyone who might contact us. So get those details, but make sure that you're collaborating and building long-standing relationships that can help you advance your understanding of the population, because place-based solutions are going to be very important for all of us. So place-based solutions can be everything from your library. We've learned that, yeah, young people, like if you give them a nice place to be where they can be with other kids who are caregivers, you've already done something that's probably not been done for them before. So I want to just give a shout out to Sarah for the work that you do and the difficult conversations that you hold close. And I really appreciate you speaking through that, because that is the truth there. Um, I did a quick Google search, your 211 website. I was looking last night, like, does it have caregiving youth in it? No. So part of the other thing that you can do, I mean, this is a room full of librarians. I don't think that I can emphasize enough how excited I was when it was librarians who contacted us, having learned about this study. I'm so grateful to Susie and Kate for that, because this is like in my mind, this is the dream. Like an entire state network of people who are educating and being educated. So you're used to getting educated on issues, and you're used to helping others educate themselves and provide resources. The best thing that you can do is to begin to think about how can you educate yourself more. And this is where I think we need to do a little bit more work. But if you even just go to the AAC website, which I noticed was posted in the chat, you're going to find a lot of things. You're going to find a white paper that was produced by the Institute and a whole group of us that founded a collaboration to try to bring together scholars and researchers to talk about the state of caregiving youth in the United States. You're going to find a lot of their programming. You don't need to go for the highest level thing. Go for the low-hanging fruit, which might be helping young people understand that there are people who understand caregiving in your facility. Post on your website. Liesl's, posters. Like, that's a great place to say, like, are you a caregiving youth? Talk to a librarian, find out, more about what we might build to support you. And I think it's very important to share your work, like show your work. So like I'm always telling my students, like, show your work, show me what you've done, what you've thought through. You all can show your work to your communities that you are really thinking seriously about this topic. You can, put up a poster that you learned about this. You can write a blog about it. You can put it on your website somewhere. You can make sure that it's getting into your schools. Show your work, because that makes a difference. It helps us all understand, right, if I go talk to this place, they already know about me. And so educating yourself so that you can begin educating others. Um, Safe spaces, a number one thing. We learned from our research of this everyday geographies of caregiving youth that it can be anything from the bunk bed, like your own individual bunk bed, because you live in pretty crowded housing or you have precarious housing, to a place in the cafeteria. So, or another room, a teacher's room, that one teacher who everyone says, oh, they're great. I hate math, but I love my math teacher because they let us come in and sit and talk. So creating that space, that time, holding it, having patience, because people are not going to self-identify as caregivers. So the other piece of educating is helping young people say, wait a second, that's me. And all of us who work on this topic, yeah, book display, love it. And together we can build better things actually for book displays. I have this whole ambition that we would have a mini library, resources online of all the great fiction that has been written with caregiving youth who are, featured, and there's some great ones. So maybe together we can finally brainstorm and that dream will come true. I have a short list. Um, but I think that being creative about who you can educate and how you can educate. So pediatricians, they are a great group of folks who would, you all can lead in educating them, because there's other resources that they can access in terms of the literature, the academic literature, but they may not even know that this is a population that they're working with. So being creative and open and if you are using the phrase and asking people if they ever encounter it, when you go into your youth services meetings, whatever those might be, you have already done the good work. So, again, just to shout out my appreciation for everyone here, because by showing up, you're already beginning to help us begin to build a network of people so that we do have the trusted adults. My dream would be like one in every school, one in every library, one in every medical facility, just one person who knows that kids are also caregivers and they could do the thing, they could say, "Hey, Fortuna, how are you doing today?" And they could just do the thank you and wish you a happy birthday on your birthday. These kinds of things, they're pretty meaningful. And just to echo, and transportation, tutoring, really important. Having, some advice in terms of like CVs, professional development stuff. All these things can be very relevant to this population.
I know we might be out of time, Kate and Susie,
No, go ahead.
um,
Go ahead.
but I just want to piggyback on Betsy because I think that there is a really strong connection between caregiving youth and McKinney-Vento. And McKinney-Vento provides rights already to transportation, to um, I'm going to forget the term now. But I think that's an opportunity that needs to be explored because McKinney-Vento does include unaccompanied youth, which is a misnomer. But what it means is that youth who are who have responsibility for themselves, as well as their kin or their younger siblings, could qualify as unaccompanied youth, which comes with then a litany of types of support. And so just thinking about that as well, there are already mechanisms for providing rights in the educational system. So just wanted to put that out there as well.
Really quickly, I wanted to share that there are a couple of things that are happening here in the state of Colorado that we really want you to be aware of. And one of them is Colorado Caregiving Youth Day happening February 27th. That is going to be a lobby day to raise awareness amongst our lawmakers in the state of Colorado. And so far, we've actually been successful in getting both the House and the Senate to say yes, they will adopt this resolution and they will make themselves available on the 27th to hear from caregiving youth, to hear from advocates for caregiving youth, to hear from anybody who cares about this issue. So as of the 27th, the state of Colorado will be on the radar of our state legislators. So I am sending to you guys in the chat the registration support form. You don't have to attend. We just want to want you to acknowledge that you are supporting this effort and this day, as well as Casey's Partnership Engagement Survey, because as a nonprofit organization addressing this issue, we are absolutely looking to establish partnerships with individuals, organizations, and entities who care about this issue so that collectively we can work to address and support kids across the state of Colorado. Thank you.
Thank you all for sharing such a depth of observation and wisdom and knowledge with us. I really appreciate that. I'm going to ask Susie real quick if we had any questions in the chat that I kind of want to toss out to you all real quick before we wrap up.
Yes, the first one is directed to Liesl. Liesl, what is the title of the position that we should be looking for on either in school districts or the State Department of Education website? Because Colorado is a local control state and it looks very different in every district. I'm thinking that if we're looking at our local school district, what would be those types of roles that we would most likely be able to connect with about this topic?
I would start with what's called a McKinney-Vento liaison, because even if the youth caregiver does not quote unquote qualify as McKinney-Vento, that person is usually the connector in their district and can get you to the right person.
Thanks, Lisa. And then the second question is for all of our panelists. Are any of you available to speak at a library staff training day, specifically in Steamboat Springs? So if I see hands
waving.
Great.
I'm
A lot
always
of our
happy to be online, but I am from Colorado and my mom and my sister still live there. The stars would have to align. I just wanted to add on to Liesel's comment that the other resource to potentially consider is veterans. And if you have any, I believe they're called Blue Ribbon schools or that network that supports children of veterans, there's quite a lot of resources available now in the US. The Veterans Associations have really picked up on this for obvious reasons. So that would be another kind of existing network in addition to the McKinney-Vento. Some of those are in schools, not all.
Thanks. So it looks like there's definitely a Steamboat. You're in luck. And then the final question that came up in the chat is, do caregiving youth call themselves that? And this is for any of our panelists. Are there other titles? Like, for example, Betsy shared that carers is a common term used in the UK. Other titles that you've heard?
That's a great question. And the answer to that question is no, they do not call themselves caregiving youth. They, in many respects, just like adult caregivers, oftentimes do not label themselves as caregivers. It's like, I am my mother's daughter and I'm doing what I have to do as her daughter. And so that label is just a label that we use to describe what it is that they do, but it's not a label that they see themselves as. So it's really important that you, in talking to youth in particular, that you use words like, do you help take care of? Do you support? Do you do specific activities to help with someone's activities of daily living, to help them get dressed, right? So you have to oftentimes break it down for them, but they will not identify necessarily with that title. And Fortuna, if you got anything to say about that, would you please?
Yeah, I just wanted to piggyback back off of that. Like, the first time we ever heard like the term like youth caregiving was when we went to a event and Nadine's table was there, and it was me and my sister. We were together, and we are just walking around observing like the other programs are there, and we seen Nadine's table that talked about youth caregiving, and we stopped. We were like, youth caregiving. We're looking at the papers, like, I don't think this is us. Like, we're like looking at each other, like, okay. And then so my sister decides to ask, she's like, what is like a youth caregiver? Because we don't know what that is. We don't usually refer to ourselves as that or see ourselves as that. And they explained to us, as someone who's taking care of a family member, someone who's taking care, a young child who's taking care of somebody. And my sister decides, she's like, even if it's like a sibling, and they said, yes, that's that you're considered a youth caregiver. And me and my sister look at each other, we're like, that's us. Like, that's us. But I feel like that was the first time, like, I even heard that term and even, like, felt seen or understood, like, that's an actual thing. But yeah, we don't really see ourselves as caregivers because it's like, it just feels natural, something natural to do.
Yeah. Yeah, we saw that a lot when we were working in Colorado with informal caregivers in the early childhood circles as well. There's this term, family, friend, and neighbor caregiver, that people often abbreviate as FFN. And you are not in a library going to be able to ask someone, "Are you an FFN caregiver?" and have them understand what the heck you're talking about. But talking to an adult who's bringing young children in the library and like maybe asking the child, "Oh, who's the adult you brought with you today?" In a very playful manner, and you might identify a grandparent caregiver that way. So, like thinking about similar strategies when talking with young people, as opposed, when you're wondering whether or not they are also providing care for someone in their family. I think, yeah. So, I want to thank our panelists so much for being here today. I so appreciate you all giving of your time so generously to help us learn and grow and continue to serve our communities, our whole communities, as much as possible. So I really just am so deeply appreciative of y'all being here. And I hope everyone is leaving this session with at least one idea you can share with someone else or one thing you could potentially put into action, because adult learning theory tells us if we do that, if we go talk to other people about what we've learned, or if we go do something with what we've learned, we are much more likely to retain it going forward and to continue to do things with what we've learned. So I encourage you to go show and tell sometime in the next week with your community partners or other staff members in your library. So we will make the recording available as soon as possible. We're going to try to get this out in less than 24 hours so that folks can have it in advance of the panel discussion, in advance of our facilitated discussion next week. So you will be able to share it with other folks if you want to convince them to come to the discussion with you, whatever the case might be. So if you're interested in the whole Talking Teen Services series, that's also available on librarieslearn.org. And so you can take advantage of that too. I'm going to just drop you a link for that. And then I will also drop the link for the survey, the feedback survey that we would love if you all have the time to fill out. We use these surveys in a couple different ways, one of which is that we provide data to our funder, the Institute of Museum and Library Services, on the work we've been doing, but we also read every single one of these surveys and take your feedback to heart very deeply. You all help guide what we offer at the Colorado State Library as far as future training and resources for you all, so that you can do the work that you want to do in your communities. So please know that we deeply, deeply appreciate the time you take to fill out these surveys, and we will read everything you have to say. So once again, like a big thank you to our panelists today. Like, again, just so grateful you all could be here. And thank you all who attended today as well for taking time out of your day to join us. I really, really appreciate the investment that you made of your own time to be here. So we will say goodbye and continue the conversation next week. Thank you for coming.